Good day, Prince Buzzy. Got my, I got bored of my old mask, so I decided to cut up a t-shirt and make another one. So here's my new one. Yeah. It's not necessarily matching, but it's good. So today, I actually do have several things that are really good news. So I'm excited to talk about that with COVID. I'm going to talk about our newest pain partner and things you can do for people with chronic pain who are at home. I'm going to talk about Nurses Week and a special we're going to have for that. And I'm going to talk about how great it is that it's warming up. So I've got a ton of COVID studies and interesting things to talk about, but I do first want to give the biggest shout out to our partner. And so this is from Aeroscena, and they make Ascents. And we've talked about when people are home with pain that you really just need to keep changing variables. So one of the things is that sleep is medicine, and that having something that you can concentrate on and distract you is really good for meditation. So we have been added to our pain care kits, number 91, which is sleep. So this is a cool packet that we will be including with our pain care packages, which is anytime you get a VibraCool, you get the pain care package with it. And so you open it up, and it's got a beautiful openable and closable tab. So you can keep this and put it, it's actually really nice. You can put it on your pillow, you can put it near you, and the thing is, after you finished using it, or the next day, you can close it up and then use it again. So these are really cool. And the reason that sleep is important, and other things you can do to help sleep, is that while you are asleep, your body does most of its repair, and it also helps you decrease the irritability that makes it so it's hard to focus on other things. So as we've talked about, if you're focusing on your pain, your brain actually becomes more afraid of it, and fear, pain, focus are all tied up together. So when you are irritable, children with ADHD, people with obstructive sleep apnea, they tend to be more distractible. And if you're more distractible, your pain is going to keep drawing you back. So sleep is one way to decrease that irritability so that you can distract yourself with other things. And having something that you can focus on is something that can help you fall asleep. So it's a meditative thing to concentrate on what you're smelling and to help you sleep. So smelling reminds me of one of the new studies that I read yesterday looking at COVID. So we're going to transition right on over to COVID. I'm going to put this list and this in our little packet here. So one of the factors that people talk about is the loss of smell. And a couple studies came out yesterday looking at loss of smell and how much that really correlates. So too long, didn't read. Basic thing is, if you have a loss of smell, that is more predictive of being COVID positive than is a sore throat. So if you've got a small number of tests to do and a lot of people who need them, go for the person who lost their sense of smell, not for the person who has a sore throat. Now, along those lines, the biggest thing is whether or not it is related to having a cold or it's actually COVID. So in those situations, the ones where you really need to worry about it being coronavirus is when you can actually breathe out of both nostrils, like, I don't know if you could hear, but I'm breathing out of both nostrils, and you still aren't able to smell. That is much more likely to be coronavirus. Very, very specific for it. It's not very sensitive because there are lots of other people with coronavirus who can still smell, but if you just have a loss of smell, very sensitive for that, very specific for that being coronavirus. So if you can breathe out of your nose just fine, it's just you can't smell the jasmine, then that's much more likely to be coronavirus. The good news though is that having anosmia as one of your few symptoms is actually correlated with a mild course. So that may mean you're one of the lucky people who doesn't get coronavirus very badly, but you're still protected with antibodies. So other studies are that, yeah, even if you've got mild cases, it turns out the antibody levels were lower for people with mild cases, but they still had antibodies, and they still had them as much as 2 months later. And we've only had this virus around for 4 months, so that was, I thought, also a good news kind of paper. Now, Some other interesting things I learned in my going on a safari through MedRx IV. I bagged a butte. So there are 2 different studies that look at pollution. It turns out one of the strongest indicators of increased severity is if you catch coronavirus in a place where there's a lot of pollution. Who knew? I mean, I guess maybe it makes sense somehow, but there was something about living in an area with higher pollution that was strongly correlated with worse outcome and more diseases. So if you've been thinking about moving to Montana, not a bad time. Moving on to other interesting coronavirus factoids. You know, the thing is, this would be great for cocktail parties. If we were having cocktail parties, you could be like, oh, I heard this interesting thing today. Guess what? But we're not having cocktail parties. And probably it'll be a while before we do, and by then no one's going to want to talk about weird coronavirus things. But other stuff that I thought was really great news was for people who have psoriasis or for people who have rheumatoid arthritis or are on injections. So many of you guys who are friends of Buzzy, if you don't know what Buzzy is, Buzzy blocks needle pain. So the whole reason that we came to exist is because I, as a pediatrician, cared about decreasing needle pain so that we could increase vaccination. And in so doing, we discovered a vibratory frequency that blocks pain, blah, blah. So a lot of people who are friends of Buzzy are because they have to take injected medications for their Crohn's disease or their psoriasis or their rheumatoid arthritis or anything where your immune system's messed up. So we're getting better and better understanding about coronavirus and how the immune system plays in. And it seems like there are your T lymphocytes, like your early markers for going to say, hey, we found infection, let's go and make our cytokines and interleukins and all the things that attack the infection, that they are going AWOL. They are nowhere to be seen. They are dramatically misrepresented when they ought to be out in force. Now, that seems like it's really wonky, but the reason that that matters is because people who are on a couple different kinds of medication for their immune overreaction, they were highly statistically likely to have better cases, to have less severe cases. So if you're on an immunosuppressant, particularly an anti-IL-6 or a CTL4, and I'm going to tell you the names. I had to write them down. So Abatacept, tocilizumab, sarilumab, or siltuximab. The mabs are like antibody. It's ab because antibodies, and it's anyway. So, but this one study looked at patients who were on those medications and found, and coupled them with other people who also caught coronavirus, and found that if you were on those classes of medication, dramatically less likely to have a severe course. Which means that for all the rest of us, we are likely to have a really good candidate for a medication that will not cure the disease, but it'll make you go toward the side who just, can't smell and you hang out and you don't feel great for 2 weeks, as opposed to the side that goes and gets ventilated. So I thought that this study, I think, is going to be one of the important ones. If it's borne out and gets peer-reviewed and works, but it was a nicely done study. And so that's exciting. We may have a really good treatment to give early on in the course of the sickness so that you can stop it. Now, the other thing is, I think that all of you know that I am strongly excited about putting betadine up the nose to get rid of to kill the virus that's up there. And this medical antimicrobial, povidone iodine. So can't use it if you have an allergy to seafood or iodine. But since we've been talking about this, there are now 10 registered studies looking at using some form of iodine for decreasing the carriage, whether it's gargling, whether it's in the nose, whether it's squirting, whether it's irrigating, whether it's using hydrogen peroxide versus betadine. All of these things. So I'm really excited that we'll have something that can make you get less sick once you go in the hospital. I'm also really excited about having something that will decrease the severity if you do get positive, and that can probably prevent you from turning positive. So stay tuned, but the more doctors and the more researchers that are looking at this, the more chance we have that we'll be able to open up. So a flip side of pollution, which is good about opening up, is that there is a magnificent study looking at temperature. Everybody's been like, oh, is this going to be seasonal? Is it going to go down? And people have said, yes, but Mexico, yes, but Singapore. Well, these guys looked at all the cases in all of the cities, all of them, and they looked at the temperature, they looked at humidity, they looked at how windy it was, wind speed, and they did a calculation, and what shook out was that for every degree centigrade you are above like 58 degrees, well, it's a degree centigrade, but from 14.6, but switching it over into Fahrenheit, so above 58 degrees Fahrenheit, every time you get about 2 degrees warmer, the number of cases goes down by about 10%. I mean, it's huge. And so what this means is that over the summer, hopefully, we are not going to see quite as many cases as are projected, and this will give us a little bit of time in our hospitals and in our tracking and tracing and testing, so that when it's the fall and the temperatures start dropping below the 60s, then we will be able to handle the disease, and we'll be able to understand much more what the parameters are. On Friday, I'm going to do just a whole talk about colleges and what I think we need to do for colleges so they can go back. But I do think that the hopeful and promised respite of decreased case transmission when we have temperatures that are summer temperatures everywhere, I think that's really exciting, and it's nice to know just how dramatic that drop is for every increase in temperature. Now, it has to be maintained throughout the day, so your coldest temperature of the day is the one that you should go by. But either way, most places in the country are going to be above 60 at night now, so that's pretty exciting. It does also suggest that maybe it's not the time to move to Montana. Maybe it's more the time to move to New Mexico. Just a thought. All right, so let's see what else I got here. Vitamin D. You know, we've spoken about vitamin D before, and it turns out that a lot of the studies that are looking at vitamin D are either theoretical or they are just looking at people who have the disease and saying, oh, they're vitamin D deficient. Well, guess what? So is almost everybody in the country. So there was one study yesterday found that there wasn't any difference in vitamin D levels for people who had coronavirus versus those who didn't. And another study was a much bigger one, and it looked at the levels of severity, and it found that there wasn't any difference for females. There was a possibility that being vitamin D deficient made you more likely to get sick for males. So what I would this is the Charlie Brown of vitamins. You know, there's always a study that's like vitamin D is going to be awesome, and then you follow the study and it's like Lucy taking the ball away and vitamin D just falls flat. It just did not deliver. So I would say if you're a dude, or if you love a dude, make them take some vitamin D just to get up to a normal amount. But I don't think this is going to be our super cure when we thought it was going to be pretty great early on, but it seems like it's not quite as great as we thought. No harm, but not huge. So I want to move a little bit over and talk about the fact that this is Nursing Week. So last Thursday, I did a webinar for the Immunoglobulin Nursing Society, which was great. Luba, thank you so much for having me. I really enjoyed not just talking about needle phobia and fainting and decreasing pain, but also really having the opportunity, now that there's like 50 studies out there talking about needle phobia and buzzy and pain and fear, talking about how to use it best. So because we have Nurses Week, and I have another webinar for the Vascular Nursing Association, Vascular Access, Association of Vascular Access next week, because of that, I wanted to give everybody who is a nurse the opportunity to, well, you can do it even if you're not a nurse, because you should celebrate a nurse. Nurses Week 2020 will get you 20% off of any of our healthcare units. Ta-da! So you can buy your nurse friends a healthcare buzzy. I'm not sure if you can see them. There they are. And we will throw in with each order one of our Buzzy Helps Buzzy Heroes cards. So then you can give this to your favorite nurse. Somebody asked how we share
Video.
these to Facebook. I have no idea how you share these to your Facebook, Julia. I got nothing. We'll try to answer that. I do know that after 2 or 3 days, once this has had a chance to be transcribed, it will come up on my YouTube channel, which I should say, if you're watching it on the YouTube channel, subscribe, touch like, or whatever, do those things. Leave me a message, but don't flirt with me, please. I'm happily married, I'm not interested. You know who I'm talking about. But if you want to share the YouTube, you can do that, and we'll try to figure out a way. I think that you can share the Facebook if we're friends with you. So if you're not following our page, that could be why you can't share it. If you are following the page, I am back to my previous answer, which is I got nothing. So there you go. All right, Nurses 2020, all one word, 20% off on our buzzyhelps.com webpage. And I think I've talked about more than we've talked about in a long time. So bottom line, Friday we will be having the good Dr. Keith on again to talk about post-operative pain and how to deal with that when you're at home. And we will talk about COVID in college. So I have a high school senior who graduates, I guess technically it was probably a week ago. It's supposed to be the end of this month. Who knows? At this point, she doesn't have any more classes, so I guess she's graduated. But the college question is a big one. Are they going to have on-campus classes? Are they going to be in person? Are they going to let freshmen go, but not upperclassmen, so there can be distancing? So I will give you my best thoughts and ideas about how you can feel safe for your college student on campus, and we'll talk a little bit about that on Friday. So if you have any questions, please write them in there. We will be putting links about Anosmia and our lovely partner, so how you can get some sleep aids. Again, I recommend melatonin, 6 milligrams to 10 milligrams about an hour before you're normally going to go to sleep, more for its antiviral properties, but certainly it's helpful in keeping you asleep if coronavirus has made you scared. And I will tell you, more today than I think in any time in the recent past. Yes, I'm bummed out that we are leaving our houses too soon, but I am so confident that the science that is being generated, the clues, the ideas about the different medications we can use to make you have a mild case, the options for decreasing the severity, the understanding of how it spreads, all of this stuff is being generated at a level that is truthfully completely unprecedented. So, as I was telling my daughter this morning, things will go back to normal. The Spanish flu had a death rate that's probably at least twice to 5 times higher than this. And after 3 years, it burned itself out and they went back to normal. And they didn't. And then the Roaring Twenties happened and people went nuts. But they didn't even have the same kind of medicine that we have now. And the medicine we have now, the best thing about it is adaptive. It can learn quickly, it can change quickly, and we can disseminate new answers and treatments quickly. So we are going to kick this thing. Yeah, we're going to spread it around, but we're probably going to get to a place where knowing you got coronavirus is no worse and probably better than knowing you got mono. So I just think it's going to be fine. See you Friday.